At the beginning of the press conference, Dr. Durain, you said, and I think this is the first time you said, that we have avoided a third wave here in Montreal. What would you credit to that success? What happened that allowed us to get out of this without seeing things get worse when they got worse in so many other places?
I think it is difficult to identify only one factor linked to the success that we had in preventing the third wave. It was like in public health, it is a multi-strategic approach. First, we started really soon at the beginning of February with some laboratories in Montreal to identify those variants. We changed completely our approach with, as I was saying, with a suppressive approach where we identified more contacts. We closed school groups and workplaces really rapidly to make sure that the progress of the variants was really slow. After we asked the government to increase the number of vaccines in Montreal at the beginning of March, asking them so we could accelerate the vaccination of the vulnerable population, and we did so, and it worked really well. We were first at this time in the vaccination campaign. We did also a specific pilot project in 2 neighborhoods where we had high incidence of variant, and so we vaccinated all the parents of the school age, and this did reduce the incidence rate in those neighborhoods. So we think it has had an effect on preventing the spreads of the variants. And of course, because the populational measures did not change, what we had as measures in January were still there with some small changes. The population was with us and did maintain high adherence to the public health measures. So all those factors did contribute, and I think right now we understand, we have more knowledge on the virus. We do understand how it is transmitted. We have an approach to variant that did work. So if we've put all the conditions in place to make sure that we were in a suppressive approach.